Welcome to Mock Interview Pro, where today we're diving into preparing you for success as a dialysis nurse. If you're gearing up for an interview in this rewarding field, you're in the right place. Let's kick things off with a question that really highlights your patient interaction skills. Can you share an experience where you dealt with a challenging patient during dialysis and how you managed it? This question is all about assessing your patient care skills and your ability to handle difficult situations with composure. Let's explore some tips on how to tackle this question effectively. Pick a specific scenario that showcases your abilities. Clearly describe why the situation was challenging. Explain your strategy to calm the situation. Highlight the positive resolution or lesson you learned. Now, let's look at an example answer to see how you can apply these tips.
In a previous role, I had a patient anxious about needles, which made them quite agitated. I spoke to them calmly, explaining the procedure and its necessity. I suggested they squeeze my hand during needle insertion, which helped reduce their anxiety. By the end of the session, they were more cooperative, and we built a positive rapport.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for dialysis nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Describe an experience where you collaborated with other healthcare professionals to enhance a patient's treatment plan. This question evaluates your teamwork skills and how effectively you can work with others to improve patient care. Here's some advice on how to craft a compelling response. Select a patient case where collaboration was key. Mention specific professionals you worked with, like doctors or dietitians. Discuss the improvements made to the treatment plan and the reasons behind them. Share the successful outcome or improvements for the patient. Let's see an example to illustrate these points.
I once worked with a patient who had complex diabetes. Collaborating with an endocrinologist and a dietitian, we adjusted the insulin regimen and diet plan. Monitoring closely, we achieved a significant drop in the patient's HbA1c levels from 8.5% to 7.0% in just 3 months.
Can you give an example of a time when you had to explain complex medical information to a patient or their family? This question checks your communication skills and your ability to break down intricate medical details into understandable terms. Here are some strategies to help you answer this question. Pick a specific instance from your experience. Simplify the medical information using clear language. Ensure the patient or family understood the information. Use aids like diagrams to enhance understanding. Conclude with the result of your communication. Let's review a sample answer to see these strategies in action.
I once explained the dialysis process to a patient's family. I simplified terms and used diagrams to illustrate how dialysis works. After my explanation, I asked questions to confirm their understanding. They felt relieved and grateful, which helped them support the patient's treatment.
What steps would you take if a patient's blood pressure drops significantly during dialysis? This situational question assesses your emergency response skills and your ability to act swiftly and appropriately under pressure. Here's how you can approach this type of question. Stay calm and quickly assess the patient. Check the patient's vitals and dialysis machine settings. Notify the physician or charge nurse immediately. Administer necessary treatments like saline if required. Document the incident and continue to monitor the patient closely. Let's look at a sample answer to understand how you might respond.
I would first quickly assess the patient's condition and check their vitals along with the dialysis machine settings. I would then notify the physician and prepare to administer any necessary treatments, such as IV fluids, all the while closely observing the patient's response.
How would you handle a situation where you see a colleague not following the correct protocol during a dialysis session? This question examines your ethical judgment and your ability to ensure patient safety while addressing professional issues. Here are some tips on handling this kind of question. Prioritize patient safety by assessing the situation promptly. Address your colleague directly and respectfully. Initiate a discussion about the importance of protocol adherence. Report to a supervisor if necessary to prevent future issues. Reflect on how this can be a learning opportunity for the team. Now, let's examine an example of how you can navigate this situation.
I would ensure the patient is safe first, then talk to my colleague to understand their perspective. I believe open dialogue can lead to better practices. If the issue persists, I would inform a supervisor to maintain patient care standards.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.